Hello, everyone. You're on the Healthy Movement channel, where we talk all about back and joint health. My name is Daria. I am a leading specialist at the Healthy Movement Kinesitherapy centers. The topic of today's video is shoulder periarthritis and how to deal with it at home. This condition is characterized by severe pain in the shoulder joint. This disease is also called frozen shoulder syndrome, and the name already speaks for itself. The muscles begin to constrain and compress our joint so much that the ligaments contract that it will be almost impossible to make any movement in the shoulder joint. Most often, this syndrome occurs among people who work with their arms up very often. For example, dentists or hairdressers often come to us. What is it? Look, the name itself already gives us a hint. The problem lies in the malfunction of the shoulder and our shoulder blade due to inflammation of the surrounding soft tissues. The recovery from this disease is quite complicated and long, somewhere between 6 and 8 months, and sometimes it takes up to a year of hard work. Therefore, you need to be strong, patient, and endure a little pain to get a certain result. In our centers, we successfully treat shoulder periarthritis as well as any diseases of the musculoskeletal system. Therefore, dear friends, if you want us to check you out, we will select an individualized complex that you will work through 3 times a week. Because regularity is the key to our health and our success. In the gym under the supervision of a personal rehabilitation therapist, please contact us. And let me remind you that our centers are located in Europe and Dubai. So all the contacts will be under this video. Sign up, we will help you. Now we will do a set of exercises with you that will focus more on the following points. The first is to pump blood to the joint itself to restore nutrition and improve muscle flexibility. The second is to stretch the muscles that seem to have tightened our shoulder and prevent it from moving. Therefore, we take water, something cold, and I will explain why it can be either a special refrigerant or a frozen bottle of water. And then we will start the exercises. To perform this complex, we will need dumbbells. I have 2 kilograms each, or you can replace them with water bottles. You can start with half a kilo, for example, then take a kilo, then gradually increase. The point of the complex is that we will first pump the muscles, warm them up, and then stretch them. Therefore, take 1 dumbbell to perform the exercise with 1 hand and proceed to the exercise. For the first one, we will need to warm up our biceps and pump blood to our shoulder joint like a pump. Therefore, we hold the elbow to the body with the upper arm and begin to bend the arm at the elbow. You should feel the tension in your biceps. We do this about 20 to 30 times. I want to say this very important thing. We don't need to chase the weight, so don't try to take a lot of weight. Let it be less, but we will do more repetitions to maximize the blood pump to the joint and always perform the contraction with effort. Here we go. Exhale as much as possible in full amplitude during flexion. Make sure that there is no movement in the shoulder. Only bend the elbow and do not move the body. Do 20 to 30 times, as many times as you can, but until you feel a good load on these muscles, be sure to apply cold to your shoulder for 10 to 15 seconds. To improve blood flow even more and dull the pain receptors. Apply cold and move on to the next exercise. The second exercise involves even more muscles of our shoulder and will be similar to the previous one, but with an additional movement. From this neutral position, we will need to bring our arm forward and, with an exhale, bend it to 90 degrees, then straighten it to the starting position. Again, lifted, bent, straightened, lowered. It looks like this from the side. Lifted, bent, straightened, starting position. Lifted again, bent, straightened, starting position. We perform the exercises in the amplitude that your pain allows you to do. Do not get to the point of acute pain. It should be tolerable. If you can lift your arm a little more, perfect. Lift it and perform it in a higher amplitude. Good, you've done it. Do the same about 15 to 20 times, feel a good load on the muscles, apply cold, and do the same on the other arm. Friends, I will show you exercises on one arm, but this does not mean that if we have one arm that is affected, we work only with it. No, we do the exercises with both hands. This is very important. Apply cold and move on to the next exercise. In the next exercise, we will work with the scapula and our triceps muscles. To do this, we will get in a supporting position, as in this case on a bench. You can replace it with a chair. Make a slight bend and relax your arm completely so that the weight stretches your shoulder blade a little. After that, the scapula goes down, bend the elbow toward the body, and extend the elbow to strain the triceps. Then back to the starting position and relax. Again, tighten, straighten, and return to the starting position with an exhale. Here you need to do about 20 to 30 times, an endurance you have. But the task is to feel these muscles and partially these muscles here. Once you have applied cold to one arm, you have to do the same on the other arm. And move on to the next exercise. The fourth exercise will activate our deltoid muscles. We have previously pumped up the biceps and triceps, and now we need to raise the blood circulation even higher through our deltoid muscles. One arm will be resting on the waist, the other arm will be raised to the side, straining the deltoid muscle as much as it allows, again, with pain and amplitude in the shoulder. Please note that there will be a very strong desire to raise the arm as high as possible, to compensate with the neck or somehow with the lower back. No, this will not be correct, and you will make it even worse for your neck and your lower back. It is very common for this syndrome to result in neck pain, headaches, and lower back pain. So be very careful if you cannot control yourself. Ask someone to help you or stand near a mirror and do the exercise. Hold it and with an exhalation, move your arm to the side, straining your shoulder. Do not move into acute pain. The exercise must be done a number of times. If you can do it even 50 times, great, do it. The main task is to warm up well and give a good blood flow to the shoulder joint. If your neck is still trying to assist, you can put your hand over the muscle and move your arm to the side of the tension here in a concentrated manner. That's great. Well done. Apply cold and do the same on the other arm. The next exercise is going to work on your pectoral muscles, which means doing bench press. Here's a very important thing. It will most likely be difficult for you to raise your elbows to your shoulders. So you will perform in the amplitude that the pain will allow you, but try to increase this amplitude each time. Normally, the exercise would look like this. Lie down on your back, take dumbbells, stretch your pectoral muscles well, and push them forward with an exhale, stretch, and push again. Try to keep your shoulders and elbows at a 90-degree angle. If it is difficult for you to lift your shoulders so well, you can do a little bit with less amplitude like this. But the main task is to stretch the pectoral muscles. Let's go. We need to do this at least 15 to 20 times to warm up our pectoral muscles well. Do not move your back or lower back, just hold it. That's good. And don't forget that after each exercise, we apply cold to the shoulder and move on to the next one. The next exercise will be done against a wall. In my case, it will be a training machine. You will raise your arms as high as the pain allows. Put them on the wall, make an angle, and exhale. We will bend forward, stretching our shoulder. You can take a small step back and stretch it well, as far as the pain allows. Do not go too far. With an exhalation, inhale and exhale. Exhale. Everyone will have their own amplitude. We do not pay attention to it. Even if it is such a small amplitude, it's okay, it will increase over time. But each time again, you try to make a deeper and deeper bend. You need to do this exercise about 20 times, after which, again, do not forget to apply cold and move on to the next exercise. The last exercise will stretch the shoulder joint, but in a slightly different position. We stand sideways to the wall and choose a position so that there is no severe pain. It can be a low, lower, or higher if you can do it. And start doing sit-ups just like that, as far as your shoulder goes. The goal is to stretch it as much as possible. When we sit up, we exhale. It is very important to make sure that there is no movement in the shoulder, no movement in the lower back, and no movement in the back. Everything is clear, even. The movement is only in the shoulder joint. After completion, again, do not forget to apply cold and do the same on the other arm. That's a set of exercises we've done with you. Save it to do it regularly, and be sure to subscribe to our channel so you don't miss even more useful videos for back and joint health. See you soon!